the rise in the country and in the continent as well. But now there's a special focus on adolescents whose increase in the number of deaths related to AIDS has been on spot. The WHO and ministry has come together to solve this particular problem. Now, adolescents have been put on the spotlight, as said before, in the fight against HIV and AIDS. This follows AIDS-related deaths increasing threefold since 2000 to 2015. However, it has come to the attention that health laws and policies fail to include adolescents living with HIV in planning.
And I'll give an update of
These speakers expressed the story of young people infected with HIV virus, many through mother-child transmission. They form the real and the subjective part of a discussion on the state of HIV spread, awareness and prevention, with a special focus on adolescents living with HIV.
When I say I'm a beautiful story, it's because for 27 years I have positively lived with HIV. I was born to a HIV discordant couple. Sorry. I'm a third born in a family of 5 children, but I'm the only one who was born with HIV. So my mom is HIV positive and my dad is HIV negative.
Disclosure actually occurred in 3 phases. On the first instance is after I had known about my status, it was hard for me to accept or to believe. So I didn't do 1 test or 2, I did 5 of them. And everything was, I'm living with HIV. So it was not easy for me. And everywhere I went, I was being told you should be enrolled on medication. But now, being enrolled on medication and the myths and misconceptions that I had earlier about the side effects of ARVs and all that.
In the discussion that brought together the World Health Organization, Ministry of Health and HIV awareness stakeholders who discussed the emerging issue of an increase in adolescents' AIDS-related deaths.
It's an issue of teenage pregnancy. It's an issue of unemployment. It's an issue of exploration, where they get exposed to many of the risk factors to non-communicable disease. That's when we start smoking. That's when we experiment with drinking. That's when we explore our sexuality. And to address all these issues, you need more than the health sector.
According to statistics from WHO, in 2018, adolescents, young people at the ages of 10 to 19, about 1.5 million out of 1.6 million of the adolescents living with HIV are in sub-Saharan Africa. 70% got the virus through mother-to-child transmission, while in 2018, of over 100,000 new infections reported among adolescents, 82% were girls. Moreover, between 2000 and 2015, the number of AIDS-related deaths related to adolescents tripled. In the meeting, the focus on adolescents with HIV has been low, leading to concern and recommendation on the inclusivity in policy making.
Sustainable scale-up for PMTCT coverage and intention is needed for the country to attain the less than 5% mother-child transmission rate by 2021. In voluntary medical male circumcision, in 2008, Kenya implemented VMMC as a HIV prevention measure. Since then, Kenya has made impressive progress in implementing VMMC programming in Kenya. In 2015, Kenya was one of the 3 countries in sub-Saharan Africa to increase VMMC, following a worrying decline in this intervention throughout the rest of the region.
The World AIDS Day will be based on the theme, Communities Make a Difference.